Thank you. I'm pleased today to move to the Bipartisan Labor, Health and Human Services Education Bill. This is focused on funding programs that provide the most benefit to the most Americans of the bills we deal with. This is the second year in a row and the second time in 8 years that this committee was able to reach consensus on a bipartisan bill. This is not the bill that Senator Murray would have written if she'd have been writing the bill by herself. It's certainly not the bill I would have written on my own. However, we made the decision that this bill is better if we can figure out a way to move forward through the committee process, and I certainly want to thank Senator Murray for her efforts to make that happen. Our effective discretionary funding level is about $800 million below last year's level. This bill is challenging at best, and more so because of that reduction in funds. The subcommittee received 5,096 member requests for this bill, and I think a vast majority of those priorities have been met in one way or another. As we move to conference with the House, Senator Murray and I have already discussed that we want to readdress two of the decisions we made in the Senate bill. I think both of us assume that before this process is over, there will be more money available to both defense and non-defense spending. When that happens, we want to look at the level of funding for operational expenses at the Social Security Administration and at the rescissions in the Pell grant program. Better to do that, I think, at that time than to make needless changes now that only will be put back at a later date when we have more money to work with. I'm disappointed that this bill doesn't reprioritize the funding or further consolidation of programs. We've done a little of that in this bill, not nearly as much as we were able to do in the last 2 years, but of course every year gets a little more challenging there. We have increased critical programs, including the mental health block grant, Head Start, and IDEA. There are other notable items I want to mention. One is that for the third year in a row, we're able in this bill to provide the National Institute of Health with a $2 billion increase. For the 12 years that ended 3 years ago, there had been zero increase in NIH healthcare funding. Our friends in the research community all seem to agree that they were about 21% lower in research buying power than they had been 12 years earlier. And over the past 3 years, we've increased funding by right at 20%. Further, during the last 3 years, we've tripled the amount of research funding for Alzheimer's disease. This bill, as part of that tripling, adds an additional $415 million toward Alzheimer's research efforts. I will point out, Mr. Chairman, that tax dollars to Alzheimer's related care already equal 1/2 of the defense budget. About $250 billion tax dollars are being spent every year now for Alzheimer's related care. The projection by NIH is that by 2050, that number will grow by 4 times, and that would be twice the defense budget, $1.1 trillion being spent on, if today's dollars, being spent on Alzheimer's related care if something doesn't happen. And so this committee is leading the way to do our best to find out if something can happen. So Alzheimer's research, additions in the BRAIN initiative, that's a major part of both what the Congress has directed and NIH is focusing on. Precision medicine, combating antibiotic resistance are there, as are ways to do some increases in every institute at NIH. It's always possible to find something somewhere different than you're looking for it, but you have to be researching in lots of areas for that to happen. Finally, this bill on the NIH front prohibits capping the indirect cost that institutions are able to count toward their granting process. Those laboratories, the capacity to be part of research has to be there for the research to be done and for the application to be made. This bill says that capping, as was suggested, cannot happen. Secondly, the committee continues its commitment to funding prevention, treatment, and research effort to combat the opioid epidemic. Nearly 2 million adults in this country have an opioid disorder. Another 600,000 have a disorder that relates to heroin. The bill provides $816 million to fight both prescription opioid and heroin abuse. That's 14 times more funding than we had just 3 years ago. The Congress has responded to this, and this bill continues to address that response. Third, the bill provides the first discretionary increase in the maximum Pell grant in over a decade. Now, Pell grants have been increasing for the last decade, but they were doing that with the mandatory spending. For whatever reason, that mandatory increase has run out, and so this bridges a gap between now and whatever the authorizing committee does to get back to where we see Pell grants grow as to reflect inflation. So there's a 1.7% increase in the cap for Pell grants. Also, I think we provided sufficient funding to continue the year-round Pell that this committee launched last year. It's estimated that over 900,000 students will receive an additional award of around $1,600 annually so that they can complete their program faster and enter or re-enter the workforce quicker. The bill also continues to prioritize funding for elementary and secondary education formula grant programs, including modest increases for Title I for low-income schools, Title IV, student support and academic enrichment grants, and impact aid. It also includes a $25 billion or a 7% increase for charter schools. Finally, the committee recommendation provides increases for many other important programs: transition assistance for veterans entering the civilian workforce, resources to implement the new Honoring Investment in Recruiting and Employing American Military Veterans Act, the Hire Vets Act that's being implemented this year, the Children's Hospital Graduate Medical Education, Rural Health and Telehealth, Abstinence Education, Pandemic Influenza, Victims of Trafficking, and Institute of Museum and Library Services. It maintains our commitment to programs like LIHEAP, community health centers, workforce training grants, AmeriCorps, Meals on Wheels, public health preparedness. This bill covers lots of territory. As I said, it's a bipartisan product. You can't develop a pattern if you don't have 2 years in a row, and so Senator Murray and I have worked to create that second year of a bipartisan bill. Before I turn to her, let me thank her staff and mine. Lots of weekends and lots of nights have gone into trying to come up with what makes this bill come together and work. First on Senator Murray's staff: Mary Laish, Lisa Bernhardt, Kelly Brown, Terry Curtin, Katie Finley, Alex Keenan. All have done great work working across the aisle with our staff, with my staff, and on our staff, Adam Sullivan, Mike Gentile, Jeff Resnick, Courtney Stevens, and Laura Friedel, our staff director, have all worked to put this bill together. And I'd be pleased, Mr. Chairman, if we could turn to Senator Murray for any opening statements she might have.